All right, Sam, we are right at 9 o'clock. And just as one last reminder to all of our guests today, we will be using the Q&A feature for any questions or comments today. We will not be using the chat or raise hand feature. So please, if you have a comment or question for Samantha Williams today, who is the administrator for the Provider Enrollment Department with Access, please use the Q&A or and not the chat or raise hand feature. And with that, I will leave it over to you. Sam, thank you.
Perfect. Okay, so we're going to go ahead and jump on in here. My name is Samantha Williams. I'm the Provider Enrollment Administrator with the Access of Division of Member and Provider Services. Thank you for joining us this morning, everyone, on this beautiful Monday morning. Today, we're going to go through APEP changes that will be effective in March 2025. We'll kind of go through the context of the changes. And then at the end, I'll address some questions that are put in the Q&A. So I'll go through my presentation, and then we'll go through some questions. Okay, so what is changing? So the Consolidated Appropriations Act has required Access to publish a provider directory by July 2025. And that provider directory has to meet certain requirements that were outlined by CMS. So a few of those requirements were which accommodations the provider's office provides for people, individuals with physical disabilities, internet website of the provider, whether the provider offers in-person services or telehealth services, whether they're accepting new Medicaid patients, and if they offer American Sign Language at those respective locations. So Access evaluated those requirements for the provider directory, and we identified a few key items that we weren't capturing for our provider network that we needed to start capturing so that we can be in compliance when we launch our new provider directory in July. So a few of those are the addition of American Sign Language, whether the provider is accepting new Medicaid patients, if they offer telemedicine, and what accommodations they offer for patients with physical disabilities. So the first two we implemented in February. We now capture American Sign Language and if the provider is accepting new Medicaid patients. And then this month in March, this coming weekend, we will add the feature that captures if the provider offers telemedicine, in-person services only, or both service types. And then in April, we'll implement our final enhancement related to the provider directory, and that's to capture what accommodations a provider offers at each location for patients with physical disabilities. And so now we'll kind of take you through what each of these changes look like so that you can see what it will look like in APEP and know what to expect. So as I said, the American Sign Language and accepting Medicaid patients is already live in APEP. So all of these changes live within the location step of the APEP screen. So we do have to capture this on a location level because certain services and accommodations offered at one location may not be offered at another location, and it really just depends on, what that organization can offer per location. So here you can see, where we capture accepting new Medicaid patients and telemedicine service, and American Sign Language services here. So this coming weekend, we will be updating the page to include our telemedicine and in-person services. So this is what it's going to look like. You'll have an in-person selection, both in-person and telehealth, or telehealth only. So those will be the new options for indicating whether telehealth services are provided by each respective location. Okay, and then the final change will be accommodations for patients with disabilities. And so this is the one that's going to be coming in April. And what it's going to look like is you'll have a pick list on the left where you can select what accommodations are available, and then you can move them over to your selected disability accommodations side. So that's how you'll indicate what accommodations by location are offered. Okay, So now with these changes, we just want to cover what the expectations are for our providers as we're going through these changes. Okay, so the biggest question is, do I have to update my APEP locations immediately to stay enrolled? The answer is no, you don't have to make changes in APEP now to remain enrolled, but we do encourage providers to make updates to their locations prior to July when the new Access Provider Directory is published. And really, we really encourage that so that the provider directory is as current and complete as possible so that when patients are looking for a provider, when our members are looking for a provider to go see, they have all of the information they need right then and there. They know if you offer telehealth, if you offer American Sign Language, accommodations for physical disabilities. So we really want that information to be as current as possible. Okay. I'm a credentialist or administrative professional who enrolls providers on behalf of my company. What if I don't know the answer to these questions? So when a credentialist or another administrative employee who is not the provider is updating a provider's profile, that person is responsible for working with the provider directly to get the information to answer the questions to the best of their abilities. The provider themselves, being an individual, should be aware of what accommodations are available at each location, and of course, within your organization, working with that provider in your organization to be able to answer those questions in APEP. All right. I've added an end date to a location in APEP, but it's still requiring me to answer the additional questions. The provider doesn't work at that location anymore, and we don't know the answers to those questions. What do we do? So Access is aware that if you go into APEP today and you put an end date on a location, it's still asking you to answer those additional questions. So again, we still encourage you to answer those questions to the best of your ability, but just know that since the location will have an end date indicating that the provider no longer provides services there, that location won't go in the provider directory, so those questions won't transfer over. So again, just encouraging you to answer those questions to the best of your ability, working with your organization and the provider to get those questions answered. Okay, so that covers the provider directory enhancements that are going in this weekend. And so I do want to shift gears just a little bit to another change that will be going into effect this weekend as well. Okay, so beginning March 16th, 2025, APEP will begin to systematically deny new enrollment applications when the application has been sent back requesting additional information and not resubmitted to us within the 30-day timeline. So this requirement, the requirement to resubmit timely has always been a requirement. So this isn't really a change in what our expectations are for providers and for applications. It's really the system is going to be closing out these applications for us. So before my provider enrollment team members would have to track those applications and then go manually, deny them for not resubmitting. This change will systematically deny applications when they're not resubmitted in the time frame that they're required to be. So it is possible, if you're not being responsive and engaging with the application and resubmitting it, the application could be denied for failure to resubmit. So again, this scenario is, your application has been submitted to us at Access, and we've completed our review and determined something was missing. So we've sent it back requesting additional information. And if that 30-day timeline expires and the application is not resubmitted to us, it will be systematically denied. So I just want to cover best practices for how do we avoid this and how do we navigate this, right? So my biggest piece of advice for navigating any application and engagement with Access is to set your correspondence preference to email. Email is, of course, the fastest way for us to engage with you and let you know, hey, this is what's missing as part of your provider application. So, in APEP, you can select email or standard mail as your correspondence preference. But of course, we really encourage you to select email as your correspondence preference so that we can quickly engage with you when your application is sent back requesting additional information. The second piece is, respond to requests from Access timely and with the requested information, right? So if you get that email or that snail mail, if that's your choice, um, requesting additional information, just make sure that you respond and provide the information before that 30-day timeline. And then it'll get back in our queue and we'll be able to review it. Lastly, when an application is denied for failure to resubmit timely, it's absolutely every provider's right to ask for an appeal, but it's often faster to submit a new application. So, the appeals process, can take some time. And I just, want to remind everyone that enrollment effective dates are effective the date that we approve them. And so all of these things kind of come together, responding timely and, resubmitting an application is probably the fastest path to getting your application reviewed and getting that enrollment completed. So again, it's absolutely every provider's right to ask for an appeal, but it's often faster to just start that new application. Access will not reopen these applications when they are not submitted timely. The requirement will be that you start a new application. So we really, really encourage you to respond to requests from Access for additional information so that we can help you finish up your enrollment journey. Okay, so that is the end of our presentation today. And so now I will jump over to the Q&A section and we can go through some of the questions. The first question I see is, will we be sending out the presentation? We will be publishing materials from today's presentation. We're hoping to get those published out this week. We encourage providers to use www.azaccess.gov/APEP. And there's a resources page on there where we frequently publish resources and provider updates. So definitely be on the lookout for that. We'll publish the materials. We'll publish some more of the frequently asked questions. We had this session last Thursday as well, and we got some really great questions from our provider community. So, we'll be looking to publish the presentation and, some of the frequently asked questions so that we can, provide that as a resource for our providers. Okay. So I do want to say that I am trying to keep the scope of the Q&A to the content that we are presenting on today. So if there's questions in the chat that's really not related to these APEP changes that we're going over, I might skip that question. Of course, there's always these resources for you to be able to engage with us and ask us any questions that you need, or if you need some technical assistance, you can always email us at APEP training questions. So again, if I skip over your question, it could be because it's not really within the scope of this presentation. So I'm going to try to get through as many questions as we can here. Okay, so this one's related to timeliness. It says, does Access have a time limit for processing an APEP application? It's taking a long time. So in general, our processing timeframe is 30 to 60 days from the date the application is submitted. But I say that, and I want to make sure that it's clear, it's from the date of submission. So if you submit the application and then we send it back because we need additional information or a correction needs to be made, the time frame resets when you resubmit that application. And we do that because we work our applications in the order they're received. So we go in date order. So if you resubmit that application, your 30 to 60 day time frame resets. And so that's why we really encourage providers to, be sure you're providing everything up front to make your application successful. Okay. When an application is denied, we need to do a new application. When a new application is started, the error message comes up that the person is already in the system. Will that be fixed? That's a great question. Thank you, Robbie. So we made sure that when these applications are denied, that error won't occur, because what you're experiencing when you see that error is the system thinks it's a duplicate application. With this system enhancement for automatically denying, we made sure that barrier will not exist for the new application. So if the application is systematically denied for failure to resubmit, it should be seamless to go in and start your new application. Where can I find the correspondence preference for email notifications? That's a great question. So in APEP, under the step called correspondence address, when you go into that, you click into your correspondence. So usually there's a mailing address there. When you click into that, there's a drop-down selection for your correspondence preference. And so it will allow you to pick standard mail or email. So that's going to be in your correspondence address step within APEP. Will the applications be reviewed in their entirety and all missing items requested the first time instead of asking for one piece of information at a time? In general, that is the goal, is that, we want to provide the best customer service possible. We complete a full review of the application and be able to tell you everything that's needed at one time to, hopefully increase the successfulness of the resubmission. So yes, the absolute goal is to make sure we're naming everything up front that's needed to have a complete and successful application. So this one says, when assistance is needed by the provider regarding new applications, a request is sent via email. However, the provider has 30 days to make corrections to the new application, but APEP has 45 days to respond to our emails. So I think this is probably in regards to emails sent to APEP training questions. Um, so in general, we've been doing a lot of data analysis as far as our response rates, and for inquiries sent to our APEP training questions, we average a response rate of about 12 to 15 days to respond to inquiries sent to APEP training questions. So, this is another area where we strongly encourage you to, engage with us as early as possible, because if you do have some sort of question or clarification needed, you can email us here, and we would be happy to help you. Okay, this says, when I tried to update our preferred email, I was asked about paying a fee. This seems excessive. Do I need to pay a $700 fee to update our preferred correspondence method? So typically the answer to that is no. But in that case, that sounds like a pretty specific scenario where just some historical information on that. During the pandemic, during the COVID-19 pandemic, actually all of the providers at that time received what was called an application fee waiver. And so if you're experiencing that, it's because you received that waiver back in, during the pandemic, so around 2019, 2020. And since you're engaging with us now, we are required to collect the application fee. So that's realistically why you would be seeing that now, is because you got a waiver for your application fee in the past. So that's more than likely the scenario that you're seeing there. Okay, so this question says, when we get answers back on what is missing, can it include instructions? So we do try to be as specific as possible when we send these back, but we always welcome opportunities to make those instructions better. So I can definitely take that back to my team and look at some of the instructions that we do send and see if we have excuse me, if we have opportunities to strengthen that instruction, again, to just help the success of the provider application. If your providers have multiple locations, is there an option to choose more than one location? Um, I'm thinking that question is like, is there a way to like bulk update the details on the location steps? Currently, there is no system function that would allow us to do that, but we are definitely, taking this opportunity now to look at how we can improve the provider experience in those scenarios. And so feedback like that always helps us, identify opportunities that makes the user experience easier. So currently, there's not a way to like essentially bulk update those, but again, we're constantly looking for opportunities to improve that user experience. Okay. How can I find out who at my facility has login access to APEP? So you can definitely send you have a few different options there. So you can, actually all of these options. So if you need to know who has access to your profile, you can you can live chat with us, you can call provider services, or you can email us at APEP training questions, and we can tell you who holds that domain access to those facility profiles. Also at azaccess.gov/APEP, there is a useful resource that walks you through domain transfers in APEP. So it has step-by-step instructions on how to manage domain access, as well as if you need to acquire domain access because maybe the person who had access no longer works for your facility. That document has very comprehensive steps to take to help you gain access. Okay, let's see. Okay, so this says when a billing group and the primary location on the individual doesn't match the group primary location, it doesn't seem to be able to be updated. I have had it returned with no instructions on how to update. Um, that's strange. You should be able to update an individual provider's location. So currently the location step and the group affiliation step, they don't communicate with each other. And the only thing we're looking for as far as the group association is we do look for a W-9 for that group affiliation. So I would encourage you to maybe make sure that you've uploaded a W-9 signed within the last 12 months for the group, but that shouldn't prevent the individual provider's location from being updated. So that really shouldn't be happening. And if you're finding that's happening and you're needing clarification, definitely send an email to us at APEP Training Questions so that we can do more digging and fact finding to help you through that barrier. Okay. Okay. So I'm still reading through questions here. So Annette asks, which is the best way to engage to ask a question? Emailing APEP training questions or opening a service request? Annette, those are actually the same thing. So when you email APEP training questions, it communicates with our service desk portal. And so if you already have a service desk portal account and you're familiar with how to start those inquiries, both of those methods go to the same place. So those are the same. Okay. So this one says, we are an FQHC group and all our 9 applications are enrolled in APEP. When we enroll a new provider and have to add the locations the provider will be working at, why do we have to go through all the locations details again when the locations are already added with those details? Um, so I think the short answer is that APEP is built to collect locations on a provider specific level. And realistically, we can't make an assumption that Dr. Smith works at all of those locations when, Dr. George might only work at 1 or 2 of the locations. And so realistically, it just could vary by provider whether or not they're actually rendering services at every single location. And so I think, in that light too, we really only expect the locations where that individual provider is rendering services. So, if you have 9 locations, but that individual is only working at one of them, we would only expect them to list one location the one location they're working at. So, realistically, the location step is intended to capture on a provider-specific basis where that provider is physically rendering services to our members. So I'll answer this one because I briefly touched on domain transfers earlier. Sarah asks, has Access considered changing their process for domain transfers from zip code to a social security number? So Sarah, that Access to applications that are new enrollment applications will look at that zip code, and if there are additional security criteria within the application, it will ask that too. It kind of depends on where you are in the process. So for new enrollment applications, that's where it's asking for the zip code, and it's a little complicated, but new enrollment applications, when you're using that track application feature, nobody has domain access yet at that point in time. Domain access is established when a provider is approved for enrollment, and then that's when domain access comes into play. So that zip code that you're talking about would really be for new enrollment applications. And in that case, again, if there's only a zip code available and no other identifying criteria, that's what it's looking for. But if there's other security measures, APEP does look for other security information to be entered to be able to access that application. So Samuel is saying, I am unable to make any changes or updates in my APEP web portal. If for some reason you are, I don't know where you are in the process. I don't know if you're not able to log in, or maybe you get logged in and you're not able to make updates. Definitely engage with us and let us know what barriers you are experiencing so that we can identify, what the root cause is. Something that got brought up at the last forum that I just wanted to mention is, some providers experience when they log into their APEP profile that everything is grayed out. They can see all of the information on their profile, but everything is grayed out and not functioning and won't let them update it. Sometimes what happens then is that you're logged in as a view only profile. And so you would need to log out and then log back in, not under the view only profile. So, sometimes that gets us a little bit, if you log in view only, it's not going to let you update anything. So another question is, does this apply to HCBS in-home care agencies? The answer is yes. So in general, these requirements apply to all providers that are applying. Um, and so one of the frequently asked questions we've gotten in relation to this as well is, does everybody have to be included in the provider directory? We did seek some clarification from CMS on who has to be included and who doesn't, and that's something that we're looking at trying to get written up and published with these materials so that we can just make clear what our federal obligation is as far as what gets published and what does not. So in general, though, we are asking these questions for every provider type at that location step. So this says, is there another presentation on navigating the APEP website so that any updated information can be provided in a timely way? That's a great question. So what I'm going to do is I'm going to go ahead and share my screen here. I can just briefly show you our provider website so that you can use this as a resource, to your point, to get timely information and updates. So this is the Access home screen, and all of our provider enrollment information lives under this link. And the short link is azaccess.gov/APEP. And this is really going to be the provider enrollment go-to source for information. So, this landing page has a lot of great information that you need to know when you're preparing for your enrollment. Here's the domain access link that we've discussed earlier. And of course, the links to get into APEP. And so when we're looking for information or updates, timely updates, we do have our provider updates section. And so here you can see we announced our upcoming changes for March. And also there is a subscription link here for our Constant Contact distribution. And if you're not registered under our Constant Contact, I super encourage you to enroll for updates from our Constant Contact, because we use that fairly often as a resource to be able to connect and engage with our providers and let all of you know about changes like this before they happen. So I definitely strongly encourage you to, use these resources, subscribe to our Constant Contact, and, we'll be happy to, happy to engage with you. Okay. Will we have to pay a fee to make these updates? So again, the general answer to that is no. So individual providers don't have an application fee. And again, I think the situation that somebody had mentioned earlier was related to an organizational fee that had a waiver back in 2020 during the pandemic. So, but in general, no. I mean, there's no fee to be able to update your provider profiles. Okay, so does this apply to anesthesiologists that are hospital based or ambulatory surgical center based? So the questions do apply to all applying providers. So in general, yes, it does, because so realistically, the questions apply on a service location basis, right? So if you're providing a service at a hospital or at an ASC, I know anesthesiologists are a little bit different, because you don't just go see an anesthesiologist specifically, right? You're going in for a procedure. You need obviously an anesthesiologist as a part of that procedure. But the answer is still yes. Those individuals would still have to answer the questions. The Roxanne says, if I have 60 employees, do I have to update every address for every employee? So this kind of goes back to our best practices. It's not a requirement that you go update these, it's not required that you go update this before July. Nobody's at risk for termination in relation to these questions. So there's no rush to go answer these questions for all 60 employees. I think realistically, just being mindful of maintaining your provider profiles, right? So if as you go through and maintain those 60 provider profiles, you will at some point be required to answer those questions, but it's not, we're not expecting you to drop everything and scramble right before July to go and get these questions answered. Will the changes to the provider directory be reflected in the provider listing on the Access website or elsewhere? Rick, that is an excellent question. So it's actually, the new provider directory will, in essence, replace the current provider listing that does exist on the Access website, but we don't exactly have information yet as far as where it's going to live. We're still in the planning phases of that and, working with our systems teams. But that's something that we'll definitely communicate out to our provider network, once we have that information. We're definitely committed to being as transparent with these changes as possible and offering information, when we know. So just look for more updates on that. Again, provider updates, Constant Contact. We will be sharing, information about our provider directory as we get closer to that July timeframe. Is there an easy way to remove old documents like an expired license for professionals to allow completion of the application and submission of these other changes that are being asked of us, or do we still need to submit help through customer service? So that's a great question, Kimberly. So we are aware that APEP does present a barrier with license uploads specifically, and we are working on a solution for that. But if you're trying to upload new documentation and like that license isn't allowing you to upload another license, instead of asking us to delete or remove any or upload it for you, you could still upload it under like the miscellaneous document type, and we'll still see that in there. So even though it's not allowing you to upload it under the license type, go ahead and use that miscellaneous or other document type so that you can still successfully upload your document and continue with the submission of your modification. So as a school district, we are accepting new Medicaid patients who are our students. However, we are not accepting the general public. How should we answer that question? I still think the answer to that question in general is yes. We don't have any specific caveats on that question. So I think the most appropriate response for that question is still going to be yes. And of course, it's within the scope of your students. Um, So this question says, is there a past or current saved video regarding login issues with APEP? In general, no, but there was an incident about a month ago where APEP users' passwords did get reset, and APEP sent out a systematic email saying you needed to reset your password. So if you're having issues logging into APEP, I encourage you to use the forgot password link and go through that process to get your password reset, because it's possible that you just need to instigate that password reset again. And then when you're doing the password reset flow, I just want to remind everybody it's going to ask for your APEP user ID, and your user ID for APEP is not an email address. So APEP doesn't allow email addresses to be used as a user ID. So if you're entering an email address and it's not sending you anything, it's because your user ID is not your email. It's something else that was established whenever you established your APEP login. So user ID is not your email address. So go through that flow, and if that still doesn't work, engage with us, send an email to APEP training questions, and we'll take a look at that. Our internal systems team has been really excellent at prioritizing those and making sure that we can get you into APEP. So if the password reset flow doesn't work, engage with us, and we're happy to help. Okay. So this question says, when resubmitting a denied application, will it take as long as it's taking now? Also, when the application is sent back, will it get addressed right away or put back into the queue? So that goes back to, we review all of our applications in the order they're received. And so if it's sent back for corrections and then resubmitted, it does start that 30 to 60 day time frame over. So it does not get reviewed right away. We review in the order of which the applications are received. Okay. Stephanie asks, can you please go back to the slide with the disability accommodations and go over specifically what those are so that we can be prepared? Sure. Okay. I don't know. Can I zoom in here? How do I do that? I don't know how I would zoom in on this. Okay. Okay, so Stephanie, I'll read these off. I know it's probably a little bit small on my screen. So the elements that are added on here that will be capturing for accommodations for members with physical disabilities. Um, we'll be asking, is it handicap accessible? Yes or no. Accessible offices, patient lifts, accessible examination tables, accessible imaging machines, accessible scales, and communication aids. And by that, we're referring to if they offer Braille for the materials at the location. And Stephanie, we can make sure that this information is included when we publish materials on the Access website as well. Again, just to help you all be prepared. Okay. Would you show how to revalidate on the APEP website? The site is very cluttered, and after trying to revalidate for 2 months, I finally sent the application by mail. Okay. I cannot share my screen specifically for that because it would, when I pull up applications, it will reveal protected information that I can't open up in the forum right now due to members, I can't share that information. But what I can do is I can show you where on the Access website to go. We do have a revalidations page specifically here that goes through the steps on how to complete that revalidation. So, of course, you will log into APEP, manage provider information, complete all of the steps, and then upload your documents, sign the participation agreement, and submit. So those are the basic steps for how to complete a revalidation. And Marilyn, you said that you sent the application by mail. We do not accept applications by mail. We require our applications, whether it's a new enrollment application or a revalidation, to be completed within the APEP system. So, I encourage you to try to follow these steps again. If you're still experiencing barriers, please send us an email. And we'd be happy to help and see what kind of issues you're experiencing and help you clear that barrier. But we do require that application to be submitted in APEP. Is the denial application systematically happening only on new enrollment applications? So the feature is only for new enrollment applications at this time. Okay, let me go back to the top here on these questions. Okay. So we'll go through a few more questions here, and then we will probably wrap up for the day. So I'll go through just a couple more questions, and then we will conclude. Okay. Okay, so Sandra asks if the forgot password isn't sending the email to reset the password, is there another way to get the password reset? So yes, definitely send us an email at APEP Training Questions, and we can initiate that password reset email for you on our side and get you through and logged in. So generally, I wouldn't answer this question because it's not related to the subject matter, but it's a fast one. Are certificate and transmittals still required? They are not. We do not require CNTs anymore. ADHS no longer issues those documents. We're able to determine provider types for those types that formally use those from the ADHS website. So we CNTs are no longer required. Is this required for out-of-state providers' applications? So all of these changes are impacting all of our providers, whether they're in-state or out-of-state. Is there a way to see when the active provider enrollment date to gear up for when the 4 years will be expiring? There is a way to view the provider's revalidation dates in APEP. I don't know what the specific steps are, but I can try to find that out for you. In general, as a general rule, if you are able to view the welcome notice that you received when the provider enrolled, it's going to be 4 years from that initial enrollment date typically. We also do publish our upcoming revalidations on our Access website as well. This question says, regarding all group home locations, we now need to list all group home locations on each application. That's a question. And is there a way to upload a list of group home locations instead of typing in them all? So in general, the answer to that, well, each group home location is required to have its own access ID. So if you are a licensed group home, it's one access ID for one licensed group home. So they would all have to have their own separately enrolled profiles. Okay. This says, are we not able to add anything for our company if the provider in APEP is still in review with their old company? So if in this scenario, it sounds like maybe there was a submitted modification under a prior employer, and now that maybe that modification is still in state review, and they're now working for your organization and not for the prior employment. So you wouldn't be able, in general, you're not able to pull those back if it's been assigned to a state worker for review. So in that case, you have kind of two options. You can wait and see, wait for that modification to be either, responded to by the state. Also, you can email APEP training questions and you can describe the scenario. And a lot of times we can push that modification to you to be able to make whatever additional adjustments you need to make. Okay. On that note, I think this is where we're gonna go ahead and end. So just to conclude, I want to restate that we're gonna have materials published on the Access website in relation to this presentation, so that you can independently review it. We did record the sessions, so we're gonna clean up the sessions and get them posted on the Access website for anybody who may not have been able to attend. We'll get the information out there. We're also analyzing our questions that we've received between both sessions just to identify any further opportunities and frequently asked questions to be able to help support our provider community. So we will take all of your questions back and evaluate them and see what we can do to make more resources available or see how we can support our providers in their enrollment journey. So thank you everybody for joining us today. Be on the lookout on the Access website, hopefully this week, for the materials from today's presentation. And I hope everybody has a great week.